All right, so hi there one more time. So we already talked about glove removal. Now we're going to talk about how to use check call care. So basically what you're doing with the check part of it, you're not just checking the person, you're also checking the scene. So what are some things you could be checking for scene-wise if you come across the scene of an accident, especially where there's cars or liquids or anything that could be volatile. You want to make sure that the scene is secure for you to go into. You don't want to become another victim before proceeding. So once you have established that the scene is safe enough for you to walk into or enter into, then you want to check any victims or check the person that you want to help. And how you check them are two different ways. So if they're an adult, you'll check them. Usually, I don't have anyone here to help me with this right now. Generally speaking, if you have somebody lying on the ground, you want to tap their shoulders and just say, hey, are you okay? In a loud enough voice so that they can respond. If they're not responding by moaning or making some sort of a sound, then you'll want to make sure that you call 911. In most cases, you'll call 911 as anyway, especially if you come across the scene of an accident. So you either call 911 or you have somebody else that might be on scene call 911. And then from that time there, once you checked out the scene, checked out what their possible scenarios are, then you'll want to give care. If it's a child, an infant, okay, then with a child, you can generally do the same thing, tap on the shoulder, but with an infant, they're not going to respond the same way as an adult or a child can respond or does respond. So you want to touch the bottom of their foot, kind of rub your finger along the bottom of their foot and see if they respond to that. If not, then you'll proceed with the calling and the caring. Okay, so just show me a video either with someone or talking through the steps of check call care. It'd be better to have someone. So hopefully you have someone at home that you can work with that can help out, unlike myself right now. But that's basically what I'm looking for, is for you to do the check. So tapping on the shoulders, or in the case of using an infant, check the foot, or even a small child, you can check their foot as well. And then calling, so you're going to call 911 quickly, or have somebody else call 911 for you, and then proceed with care. All right. Hopefully, if you have any questions, hopefully it answers questions, but if you have any questions, please let me know. All right. Take care. Have a great day.